Good day everyone, my name is Kusha Maria Pelga from Sasini Iloilo Batch 3. Today I'm going to perform nasogastric tube insertion. What is nasogastric tube insertion? Nasogastric tube insertion is a method of introducing a tube through nose into stomach. The purpose of this, number 1, is to feed client with fluids when oral intake is not possible. 2, to dilute and remove consumed poison. 3, to instill ice-cold solution to control gastric bleeding. 4, to prevent stress on operated site by decompressing stomach of secretion and gas. And 5, to release vomiting and distension. Before beginning this procedure, always perform the following steps to ensure patient safety. 1 is to wash your hands per CDC guidelines. 2, introduce yourself. 3, use patient identifiers. 4, verify allergy status. And 5, materials needed for tube insertion. The materials needed are Lopez valve, cup of water and straw, suction tubing, specimen cup, stethoscope, water-soluble lubricant, absorbent pad or towel, pen light, tongue blade, pH strip, tape, NG strip, irrigation tray, piston syringe or 10 ml, and nasogastric tube in appropriate size.
Ensure privacy.
Close the windows and door.
Perform hand hygiene.
Good day, ma'am. My name is Kusha, your caregiver for today. May you state your name and your birthday, ma'am? Okay, great. Thank you, ma'am. So for the procedure, first, perform a GI assessment assessing need for nasogastric tube placement. Place patient in high Fowler's position and cover chest with towel or chalks. Excuse me, ma'am. Using a pen light, assess for any facial or nasal passage issues contraindicated for this procedure. If suction is ordered, verify suction source at this time. Connect suction tube to source of negative pressure, setting control, or physician's order. Obtain the appropriate equipment for nasogastric tube placement. Measure from the tip of the nair to the earlobe using the entry tube. Then measure to the xiphoid process of the sternum. From the tip of the nair to the earlobe. Then to the xiphoid process of the sternum. Then mark the distance of a tube with a piece of tape or marker. Lubricate first 4 inches of the tube with water-soluble lubricant. Then ask the patient to slightly flex the neck backward. Insert tube into nair gently. Excuse me, ma'am, can you slightly flex the neck backward? I will insert the tube into nair gently. Pull back tube slightly when patient starts to gag until gagging ceases. Ask patients to tip forehead forward. Give water with straw if applicable or have patient dry swallow if necessary. Advance the tube several inches at a time as the patient swallows. Advance the tube until the tape or mark point reaches the nair. Pull back the tube immediately if there are signs of respiratory distress. Secure the nasogastric tube in place. Do not let go of the tube until secured. Verify placement of the tube. Aspirate stomach content to test pH. Then collect gastric content and test the pH. Connect the distal end of the tube to suction draining bag or adapter after placement is verified for evidence-based guidelines. Dispose of soiled supplies, ensure safe environment, return bed to lowest height with brake lock, and appropriate side rails up and call light or bell in reach. Wash hands for CDC guidelines. Record the date and time, the size of the nasal gastric tube, the amount and color of drainage aspirated and relevant client reactions, sign the chart, and report to the senior staff.